Namaste. Now we have already learnt about Tridoshas and their gunas, their prakrita karmas, their sthanas, their vriddhi lakshanas and their kshaya lakshanas. So after learning all these points, we might have got an idea about what exactly dosha is. So let us quickly move on to the next topic, that is dosha bheda. Now before going into the topic, let us first ask, what is this dosha bheda? Why is this classification of the doshas are mentioned even though it is being said as doshas are only three and there is no fourth dosha? Even then there is a classification of the doshas, and is it of any importance, or what is the significance of these classifications? How does it help us in the clinical practice? Is there any reference regarding that in Samhita? Let us see. So in Ashtanga Hridaya Sutrasthana, 12th Adhyaya, that is Dosha Bhediya Adhyaya, Acharya Arunadatta mentions some of the factors. So let us see what he says. Tadbhedascha sthana karmavastha hetvakriti sadhana samyoga bhedat bhavati. So he says that there are 7 factors through which we can understand this classification of the doshas in a better way. Now, why these 7 factors? Because if these 7 factors had not been given, then we would not be able to think about how the doshas are acting or how the doshas are present in the body in different perspectives. So, totally, it means to say that these 7 factors will give us a broader perspective of how dosha looks like and how the movement of dosha happens inside the body. So, without getting confused with all the 3 doshas, let us take an example of one dosha, and remaining 2 doshas will be understood based on the 7 factors. So, let us take an example of Vata dosha. So, the first factor is sthana. That is, tatra sthanato yatha pakvashayastho ayam vayuhu katistho ayam. Now, when we look at this, we remember that we have already learnt about the dosha sthanas. So when we have already learnt about the dosha sthanas, it is being said that Pakvashaya is said to be the Pradhana Vatasthana, and there are other Vatasthanas as well. Now, what is this importance of sthana in the clinical practice? So, in clinical practice, we will be able to see the lakshanas of Vata, that is, Vriddhi lakshanas or Kshaya lakshanas in different Vata sthanas. Instead of looking at only Pakvashaya for Vata Vriddhi lakshana or Vata Kshaya lakshana, we can have this understanding that the lakshanas might be visible in different sthanas of the doshas. So that is how the sthana will be helping us understand the classification of the doshas. Now the second factor, that is karma. Karmato yatha shvasochvasa pravartako ayam vinmutra pravartako ayam. So we have already studied about prakrita karma of the dosha. So when we look at vata dosha, it is being said as uchvasa nishvasadi karma. Also, we have seen that vinmutra pravartaka karma of vata. So when we look at these 2 different karmas, we may think that is it the same vata dosha acting in 2 places? Yes, the same doshas are acting in 2 different places in a different way. So that is what we may have to understand here based on this factor called karma. So how is this related with our clinical understanding? So in clinical practice, if you have to say, if there is the prakrita karma of an individual dosha, which we have already understood, if there is any deflection in that karma, we may understand that this particular part or in this particular part of the sharira, this particular dosha has vitiated. So based on that, it will become easy for us to understand the vyadhi or to come into the conclusion of diagnosis. So this is how it helps us in understanding the classification of the dosha. Next, we'll move on to the third factor, that is avastha. Avasthato yatha chito ayam prakupito ayam. So here Acharya said about 2 Kriya Kalas. It doesn't mean that it is remaining to be only 2 Kriya Kalas. We have already known about Shad Kriya Kalas. So it might be Sanchaya, Prakopa, Prasara, Sthana Samshaya, Vyakta as well as Bheda. So based on this, we might have come across this particular shloka called Chayaprakopa Prashamaha Vayurgrishmadishu Trishu Varshadishu tu Pittasya Sleshmanaha Shishiradishu. So what does this mean? Here, Acharya has mentioned about the Chaya, Prakopa as well as Prashama of all the 3 doshas. That which used to happen naturally, swabhavataha. So here it is mentioned as Chito Ayam, Prakupito Ayam. So when we look at doshas, when it is in Sanchayavastha, it has some of the lakshanas. When it is in its Prakopavastha, then it might show some of the lakshanas. Or when it gets Prasara, then it might show some other lakshanas. So avastha or knowing this avastha will be helping us to understand the dosha, or where exactly the dosha has lodged, or from where exactly it has left, and where exactly it is traveling, in which path or in which srotas it is traveling. So based on this, avastha becomes the important factor in understanding the classification of the dosha. For any vyadhi samprapti, there needs dosha as a sannikrishta karana. So dosha is the prerequisite for the formation of the vyadhi. So to understand this particular samprapti of dosha converting itself into vyadhi, we need this kriya kala. Next we'll move on to the 4th factor, that is hetu. हेतुतो यथा मिथ्यायोग प्रकुपितो अयम अतियोग प्रकुपितो अयम. So here Acharya wants to explain that roga is always because of hina yoga, mithya yoga as well as ati yoga, as it is mentioned in the first adhyaya of Ashtanga Hridaya. So that is kalartha karmanam yogo hina mithyati matrakaha samyak yogascha vidneyo roga rogyeka karanam. So these hina yoga, mithya yoga as well as ati yoga will be leading us towards roga. Only samyak yoga can be leading us towards arogya. So how this hetu will be leading us towards the understanding of the classification of the doshas. First here we should know that mithya yoga of kala, mithya yoga of artha as well as mithya yoga of karma can lead to the vyadhi. Similarly, hina yoga as well as ati yoga. So here, if you take an example of katurasa as a hetu, so if you consume katurasa in an ati yoga, even though it is being said that shadrasa yukta ahara must be consumed, but if katurasa alone is taken in an excessive quantity, then it might end up having vata vyadhi. So this is how hetu influences the classification of the doshas. Next, we'll move on to the 5th factor, that is akriti. What is akriti? Akriti is the synonym of lakshana. Here it is said that akritito yatha sramsa lakshano ayam vyasa lakshano ayam. Now what is sramsa, vyasa, vyadha, swapa? All these are the lakshanas of vata which is mentioned in the same adhyaya later. So what is sramsa? Sramsa is said to be hanvadehe bhramshaha, that is the chuti of the hanvadi sandhi from its sthana, and that is caused by vata. Next is vyasa. Vyasa is said to be vikshepanam anga pratyangaadehe yatha akshepakadishu. It is throwing out or throwing away the body parts, which is exactly similar as that of convulsions. So how does this help in understanding the classification of the doshas? So when we see the lakshanas, there will be peculiar lakshanas for different doshas. So when we observe these kind of lakshanas, we will understand that this is the important or the significant lakshana of vata dosha. So when we look into this particular condition, here it is mentioned about the gati of the dosha. So which dosha has gati? That is obviously vata dosha. So if that gati is hampered, then we will get to know that this is the particular dosha which is hampered in the body or vitiated in the body. And that is when we will get to know about the proper protocols of treatment. So this is how the Akriti helps us understanding the classification of the doshas. Now, if there is the change in the gati, which part of the sharira is having this kind of lakshanas, that must be observed. So based on that, we'll be able to understand or come into the conclusion. So when the chala swabhava is hampered in different parts of the body, it gives rise to different lakshanas. But we will be able to assess that this is about vata lakshana, because this chalana swabhava is about only vata. So next is the sixth factor, sadhana. That is, sadhanato yatha snigdhopashayo ayam ushnopashayo ayam. So how this sadhana or upashaya will be helping us understand the classification of the doshas. Now, if you are not knowing that every dosha has different gunas, so based on different guna vriddhi lakshanas, we will be treating the conditions with the opposite gunayukta dravya. Say for example, if the person comes with ruksha guna vriddhi janya shula, then we may have to treat them with snigdha gunayukta dravyas. Or person comes with the shita guna vriddhi janya vatavyadhi, then we may have to apply ushna chikitsa there. Or when patient comes to you seeking the treatment, and when you take the history of that particular patient regarding the aggravating factors and the relieving factors, the patient himself might say that just by applying an oil, he might be feeling the relief of symptoms for some time. Or some other person might say that he might be getting relief by pouring hot water to the affected part. So this particular clue will help us in the treatment protocol. So next we'll see the last factor, that is samyoga. So here it is mentioned that samyogato yatha pitta yukto ayam shleshma yukto ayam iti. So these combinations of doshas will be helping us in the diagnosis. So how does these combinations will help us to reach the diagnosis in a specific way? Let us understand samyoga with a particular shloka which we all might have learned, that is Yogavahi param vayuhu samyogad ubhayarthakrit dahakrit tejasa yuktaha sheetakrit soma samshrayat. So that means when vata combines with pitta, it will enhance the qualities of pitta. As we have already seen previously that it is mentioned vata sakhitvat agnehe. So, for example, let us understand this hot coal. So, when you blow air into that hot coal, what happens? It catches up fire, right? Similarly, here we have to understand when vata gets combined with pitta, it will enhance the qualities of pitta. But considering all these 7 factors, if we start applying all these 7 factors in our clinical practice, we will be able to understand why, how and when and what doshas are included in that particular sthana where the patient asks for the help. So here it does mean that there is a special quality of vata, that is yogavahi guna. Whichever dosha it gets combined with, it enhances the quality of that particular dosha. So this is how it helps us understand the classification of the doshas, also will help us in the clinical practice. Namaste.